going to talk about Botox today, and there are a lot of different places where we can use Botox. Today we're going to focus on a few different areas. One is called the periorbit. The periorbit is this muscle that goes around the eye. Another is called the glabella. The glabella is also referred to as the 11s. It gives us these vertical lines right here. And then the forehead. The forehead is what gives us these horizontal lines up here. And Botox is indicated for use in any of those areas. We do want to use a small amount whenever we're doing it so we can get a natural result. And we inject it with a very small needle to minimize pain. So we're going to get started with that now. Botox lasts for about 12 weeks, so when we put it in, it doesn't take effect right away. So when you walk out of the clinic, you're not going to see any immediate difference. It takes about 2 to 3 days for it to start kicking in, and it takes full effect at 1 week. Then it wears off gradually over the course of about 12 weeks. I personally like mine best at about week 5, so whenever I have an important event, I always try to plan backwards and get it done about 5 weeks before my big event. Of course, because we're using a needle, there is always a possibility of getting a small bruise, so you definitely don't want to get Botox done the week of an important event, just in case you get a small bruise. So that's all there is to it. It's pretty quick. It won't take effect right away, as we said. It'll take a couple of days for it to start taking effect, and then it'll take full effect at 1 week. So we'll check back in a few weeks so that you can see the finished result. A couple other things to know before you go. It's always a good idea to avoid alcohol for 1 night before and avoid aspirin or ibuprofen for 1 week before, because if you have alcohol, aspirin, ibuprofen, Motrin, those things are going to make you bruise a little bit more. Oftentimes, people will come immediately after exercising, and if your blood is still pumping from a good exercise class, then you might be a little bit more susceptible to bruising as well. So it's a good idea to exercise before you come, but not immediately before you come. No exercising the rest of the day, but by the next day you're back at your regular activities. Hi, Dr. Thrash here from Fresh Dermatology. So we're following up on Botox today. It's been about 3 weeks since I had my Botox done. We put Botox in the glabella, which is this muscle here, which ordinarily would allow me to contract and form the 11s, but it's taken a nice effect here. We put Botox across the forehead, which has created a nice smooth look on the forehead. Notice I can still move my brows. It still looks natural, but my forehead is very smooth. There's no resting lines or lines with motion there. We also put some Botox around the eyes, so that helps prevent crow's feet from forming. It helps prevent those little cat whisker lines from forming right there. All of it took effect within a week. There was little or no pain, no bruising, and it'll last for about 12 weeks.